Hey, everybody, Saul Marquez with the Outcomes Rocket. I want to welcome you back to the podcast. And today I have the pleasure of being with Dr. Tryggvi Thorgeirsson. He is Sidekick's Chief Executive Officer and co-founder. He's an experienced physician and researcher with an engineering background. He's a great lecturer, a guest lecturer at Harvard and MIT on topics including data-driven health and the application of behavioral economics to lifestyle interventions. He is the current chairman of Iceland's Technology Innovation Fund and advises the country's government on innovation strategy and implementation. And I'm so excited that he's with us today. With that, Tryggvi, thank you so much for being with us.
Thank you for having me.
It's a true pleasure. It's a true pleasure. And so, let's discuss. And before we dive into Sidekick, I'd love the audience to get an opportunity to get to know you a little bit better. What is it that inspires your work in healthcare?
I've always been fascinated by healthcare and medicine. My grandfather, who I was named after, was a doctor, so I've always been passionate about this field. And I worked for several years as a clinician, one-on-one with patients, which is extremely rewarding. Um, and so I guess I've always had that passion. But then fairly early on in my clinical career, I just deeply felt that we could do better. We as doctors are so limited to prescribing medications and really often working downstream, putting out fires instead of preventing them. And so that's what kind of sparked my curiosity also to look a bit further. And I ended up adding a degree in public health, where you have that preventative medicine view. How can we prevent the disaster instead of waiting for it to happen? And that's also where you kind of take a step up and you look beyond the one-on-one at bigger populations and really how you can make bigger groups of people healthy.
You sort of started at the bedside, but then asked, how could I be preventative? How can I do this at scale? And I think that's a great transition to the work that you're doing now at your company, Sidekick. So tell us a little bit about Sidekick. What do you guys do, and how are you adding value to the healthcare ecosystem?
As I mentioned, working as a clinician, you get the feeling that there are things that we can do better. I mean, healthcare is a huge industry. We spend somewhere between 10 to 20% of our country's GDP on this, and more every year. But nevertheless, we see waiting lists going up, and actually millions of people's lives are lost every year because of inefficiencies in healthcare. To me, there are a few reasons for that. First off, that we tend to be so reactive. We wait for the disaster before we step in. We tend to be quite siloed, looking at each disease independently as opposed to looking at the patient holistically. And we are still really brick and mortar based. So most of our healthcare needs, we have to go into a brick and mortar institution, whether it's a clinic or hospital, sit down one-on-one with a healthcare professional instead of using technology. And I often take the analogy of the banking industry. This is how we did banking maybe 30 years ago, where you'd have to go to your brick and mortar bank to withdraw funds or whatever. But now we do maybe 99% of our banking needs online, and we just go to the bank for the really complex stuff. And the same is needed in healthcare, in my view. And so that's what we're doing every day. We are applying technology to be able to do all of these things, be more proactive, be more holistic, and move so much more of healthcare into our daily lives outside of these brick and mortar institutions. And maybe, more specifically, what does that mean is we've created a
Yeah.
digital health solution where on one hand you have an app for the patient, where you as a patient, if you have a serious condition, let's say heart failure or breast cancer or IBD or something, a serious condition, we give you all the support and information in your phone to self-manage your condition, because there's always so much that you can do as an individual to vastly improve your outcomes, and those things can be equally impactful as medication. So that's what we deliver through your phone, and I think it's also because our company is founded by two clinicians, myself and my co-founder Sam. We were both working with patients at the time, and we knew that most people in healthcare don't have one but multiple conditions going on at the same time. So we felt we shouldn't develop a point solution, but really a platform, a holistic platform, both for the patient and their care team, and use that platform to then build out a whole range of therapies. And so now there are over 20 conditions that we can work towards and support patients with. And we can even tie them together into one patient journey. So if you have breast cancer and diabetes and anxiety, we tie that together into one patient journey for you. And in terms of the value that this creates for the patient, we improve, many of our studies have shown significant improvements in patient symptoms, between 25, 40, 50% improved symptoms. And for our customers like health insurance companies and pharma companies, we've been able to show, of course, both improved patient outcomes, but also thousands of dollars per patient per year in cost of care savings, better satisfaction, patient satisfaction, and such. So it's about improving patient outcomes and making more efficient use of resources in healthcare.
Just curious about, the inputs then. Is it inputs into the app, or are you guys also integrating wearables and nearables as
Absolutely.
part of the platform?
Absolutely. As part of that platform, we basically take any data source that we can get our hands on in that sense. So any
Nice.
type of wearable that is relevant, and as well as patient-reported outcomes, all of this comes together to allow us to assess your situation. And I mean, I think a good example of how this actually works in real life. Recently, one of our clients told the story of, with the patient's permission, of a story of a 40-year-old male who was dealing with serious cancer. And because of the cancer, he's receiving immunotherapy that suppresses his immune system. So he's extremely vulnerable to any type of infection.
Mm,
But because his insurance company was working with us, he got access to our platform. And through the platform, one day our platform flagged that something didn't really look right. His nurse had a look, and within a couple of hours, he was in the hospital diagnosed with a bacterial infection in his bloodstream. And so he got immediate IV
mm.
antibiotics and was able to, get over that quite fast. But he hadn't realized how serious it was, and he had planned to stay home for 1 or 2 more days. And you can imagine, in that state with a suppressed immune system and a bacterial infection in your blood, that can rapidly become, within hours, fatal, or you would end up in the hospital in much worse state and probably needing, intensive care treatment. So, to me, that's a great example of how we can step more upstream, address things earlier, and get much better outcomes through that.
And so, in that particular instance, was it a combination of vital signs, maybe an input that led that case to be flagged to somebody, and then does is there a clinician behind it, or is it a clinical team that works for an institution?
We have different types of setups. In this particular case,
Yeah.
it was the patient-reported outcome because because of the seriousness of his condition, he filled out
Yes.
a few questions on his symptoms every day. This was flagged in the system, and on the other side, you had a nurse from the insurance company that was monitoring. And so that was the setup in that case.
Got it.
In other cases, it's your nurse from your provider, or in other cases, it's someone from our staff.
So it sounds like it's very flexible.
Yeah, it is, and I think that's also because we approach this, no, yeah, having worked for years in a clinical setting, you have to have a bit of flexibility. In some cases, it's not feasible to change the workflow of the care team, and so you have to support them either by us doing it or your insurance company doing it. And so I think that's one of the most important parts of my job, having been in this business for 10 years, is knowing where the market is ready, where are people ready to adopt, and adapting, I guess, our offering to the readiness of the market.
And so when you think about the work that you guys are doing at Sidekick, what would you say is different or better?
Yeah, I mean, I think the number one thing that sets us apart, in my view, is the fact that we have built this broad platform approach. Again, because from day one we knew we couldn't tie together neither a patient. So if you think about a patient that has two, three conditions on at the same time, there's no way they can tie together two, three different point solutions. They have to have one solution in their palm that just covers their needs. And the same goes for our
Yeah.
B2B customers, whether it's a large insurance company, a pharma company, or provider. There's really no realistic way to tie together all these point solutions, many of them black boxes. You don't really see what's going on. And so to us, being able to offer a holistic platform, both for the patient and the care team, over 20 different conditions that we cover, from all of these major conditions, heart diseases, metabolic, women's health, inflammatory, and all these major conditions. And being able to tie them together into one patient journey, that is a capability I haven't seen anyone else in the market offer. And that's also the reason why many of the most innovative and largest companies in this space are choosing our platform. I mean, LMS Health, for example, is the largest health insurance company in the US, and they've chosen to work with us to digitize their disease and care management, and which is really exciting. And we're seeing, and they've been reporting on really exciting outcomes in terms of better patient symptoms, reduced hospital admissions, and such. And so, really exciting to see that. And at the same time, also working with the largest pharma companies in the world, like Eli Lilly and Pfizer and others. So I'd say, and this is because of the broadness of the platform. Also, of course, just the quality as measured by our clinical and financial results. And I'd say maybe a third element is also our behavioral approach. So when I studied my studied my public health degree, I did
Hmm.
that at the Harvard School of Public Health. My mentor there, Professor Ichiro Kawachi, he taught us about this field that I hadn't heard about before, called behavioral economics, which is a super fascinating field that combines research in psychology and economics to really understand how we function as human beings and how we make our imperfect decisions every day. And when it comes to our health, there are hundreds of decisions that we make, mostly without knowing, every day. And we all think we're quite rational, but really, it turns out we aren't. And maybe 80% of our choices are controlled by our emotional pleasure-seeking centers. And so, um, all the way from
Yeah.
day one, we've really made sure that we design our solution also with that in mind. So, in a patient's hand, it has to be rewarding and enjoyable, even though you're dealing with a serious condition. It should still be, in some sense, rewarding, sometimes even fun. And so, we've brought in folks from like Candy Crush and other computer games, and consumer tech
Wow, that's
companies
cool.
to help us design for that.
That's cool. I love that. That's very unique, and it's a combination of the clinical expertise covering multiple different areas, and then having the resources and creativity to really guide people in their behaviors that helps you guys stand out. Love that. Thank you for sharing that, Chigby. And when you think about sort of the markets you cover, I know you're phoning in from Iceland, which is so cool. And I was talking I was telling you, my son this morning was telling me he wanted to go visit and see the northern lights. But you guys work across a lot of different areas. You work in the US with some of the largest players in Europe. Tell us more about the vision there and what you guys are up to and who you're serving.
Iceland is actually not a bad place to do business in, because we're, I'd say, both culturally and geographically right in between Europe and Northern America. So, and we have dozens of flight connections in both directions every single day. So it's actually a great place
Hmm.
to build up a company, I'd say. And we have a really good infrastructure for healthcare and healthcare research. And yeah, we do business on both sides. So working with health insurers and pharma companies, both in the US and also in multiple countries in Europe. And actually, one exciting thing that we've also been doing on the European side is, very recently we just finished an acquisition of a cool company based in Germany, who are doing what's called prescription digital therapeutics, or PDT,
Hmm.
where you have a digital treatment, with very robust clinical evidence proving that it works, and it's regulated just like any other drug or any other treatment. So it's regulated as a therapeutic intervention. And this PDT space has been, I'd say, maturing both in the US and Europe for several years, and it's been moving fairly slowly. But I'd say this year it's really taking off, and I'd say especially in Germany. A few years ago, Germany created a new infrastructure for these digital treatments called DIGA, and this year they are expecting between 150 and 200,000 prescriptions for these types of therapies in that market. So it's really beyond
Wow.
a small pilot market. It's really growing. And this company, called Aetier, is the biggest company in that space, with a really strong product for obesity, showing best-in-class outcomes in terms of weight loss in that market. And we were so fortunate to be able to acquire them and join forces with them. and really scale our solutions into that DIGA market and beyond, because there are other companies in Europe that are preparing for the same. So that's quite exciting.
Congratulations on that. So going from a platform to now also offering digital therapeutics as solutions. It's sort of with the digital therapeutics, Tryggvi, I'm curious about it. Like, do you think of them as kind of in that bucket of behavioral economics supported by clinical research? What do you think? Give me your thoughts on that.
I think that comes close to describing at least a big part of it. And maybe if I take a step back, when I always approach this as a clinician, how can I create the maximum clinical value for my patients? Because that at the end of the day creates financial benefits and value for my customers, like insurance companies and others who are really just in the business of creating health. Um, and so if I think about how can I, with my digital health solution, create clinical value, I put it in three buckets. So the first bucket is patient self-management. Like I mentioned earlier on today, we as patients, we can, there are always things that we can do that can fundamentally improve our health outcomes. And these can be equally impactful as drugs. And that's really important to realize. And so self-management is super big. The second bucket is adherence to your medication, but also to your care plan, showing up for your checkups and screenings and blood tests and such. And unfortunately, only about 50% of people adhere with their medication. For example, if a doctor prescribed a drug, about 50% of people drop off. And it's been estimated that
Hmm.
300,000 people die every year because of that, just in Europe and the US. And so that's a huge area that we can do better. And the third area is remotely connecting you with the care team for remote monitoring and remote interaction and support. All these three buckets can create a lot of clinical value. PTT or prescription digital therapeutics, I put mostly in that first bucket where we look at, what is the self-management part that you can do as a patient, and we apply really rigorous ways, making sure that we comply with clinical guidelines. And then we use behavioral economics as one of the tools to help you make those behavioral changes, because that part is always about making some changes to your behavior. We all know that's tricky, very tricky maybe.
Yep.
And so whatever we can do to help nudge you and support you and reward you for that, we use those tools. And behavioral economics is a fascinating toolbox that can help there.
Thanks for sharing your philosophy on digital therapeutics. It's a growing field, and folks, check out Sidekick. They're doing some incredible work. The recent acquisition in Germany of what was the company name you guys acquired, Tryggvi?
Company's name is Eight here, and the
Aether.
product, their product on the market now is called Zanadio, which is for obesity, and there's another product coming out next year for diabetes. But now,
Amazing.
now that company is becoming our PDT arm. We call it Sidekick RX because it's our prescription arm. And it's
Wow.
a fantastic team. They've built a fantastic product and are share our passion for this field.
That's great. Well, I love to see how the company is evolving and direction you guys are going, just to provide that all encompassing solution to the people that need it the most, obviously through their payers. And so this is fantastic. If you had to point to one healthcare trend or technology that's going to change healthcare as we know it today, what would you say it is?
Maybe I'm biased, but I would just have to look at the whole digital health field really, because again, thinking as a doctor, I fundamentally believe that within a few years, let's say 3, 5, 7 years, it's going to become unacceptable to exit your doctor's office if you have a serious condition without a digital strategy as part of your treatment plan. I think it's absolutely not going to make any sense. And so, and I think this is going to fundamentally change how we deliver healthcare. It's going to save millions of lives every year. It's going to help us use our valuable resources in healthcare so much more efficiently. And I think we're going to look back, and it's going to be mind blowing how we got by without all of that. And so I think it's going to be black and white really how we deliver healthcare in a few years with all of these technologies that they're already here. Now it's more about implementing and scaling them. So that's the big trend that I'm excited. Of course, there are sub trends with more and more wearables, which just give us more and more data. Of course, the new AI models, which just help make all of this more efficient and all of that. But the big trend is just really implementing and scaling digital health as part of your treatment plan. That's what gets me excited.
And I think, folks, the same applies for your sales and your marketing strategy in the work that you're doing. If you're not thinking digitally, you're going to get left behind. So I love that. It's such a great point. Look, we're here at the end. This has been such a fascinating discussion. So talk to us. What would you want the listeners to take away from today's discussion if you had to choose one thing?
Again, I'd go back to just stay tuned and stay open to the possibilities that digital can provide to healthcare. Just really from a clinical perspective, there's so much health that we can create, so much value in the system that we can create. Join us, help us accelerate that trend. Of course, we're always happy to work with whether it's pharma companies, health insurance companies, providers, co-innovate, co-learn, sometimes co-fail, and then we tweak. 'Cause it is a journey. It takes time to innovate and to scale a new type of treatment. We've been distributing small molecule drugs as part of health plans and treatment plans for 150 years, and we're just getting started delivering this new generation of therapies into healthcare, and that's exciting.
Outstanding. And then if people wanted to get in touch with you or your company,
Yeah.
how do they do that?
Our company is sidekickhealth.com. That's our website. And then on LinkedIn, both Sidekick Health and myself, Tryggvi Thorgeirsson, definitely follow us, contact us, and reach out.
Amazing. Well, folks, there you have it. Dr. Tryggvi Thorgeirsson from Sidekick. Certainly make sure you check out the show notes for ways to get in touch and learn more. Dr. Thorgeirsson, this has been awesome. I've enjoyed our discussion and certainly looking forward to staying in touch with you.
Absolutely. Likewise. Thank you as well.